So my warm wishes to all of you. So why mental health matters? Let me start my talk by just introductory remarks amounting to just 2 minutes. Then we'll open up the session for an interactive discussion in which you can raise your concerns, thoughts, doubts, criticisms, and your whatever you want to know about mental health. And over the next 35 minutes, I'll try to answer as much as possible. Why mental health is relevant is because in 2025 January, just before the union budget was tabled in the parliament, there is a document called National Economic Survey. It's an analysis of the economic situation of the nation over the last 1 year and what the government of India plans to achieve over the next 1 year. This document had certain significant mention about mental health. There were two areas in which mental health was mentioned in the economic survey. Number one, it went on to record that 10.6% of the total population of India are suffering from at least one mental health problem which requires intervention. And untreated mental health problems translate into reduced work efficiency at the individual level, which automatically translates into reduced productivity of the organization which employs that person. And this translates into economic backwardness of the nation. So mental health of the individual citizen was accepted for the first time in the history of independent India as an important determinant of economic progress of the nation. Second mention in the same document was about how the digital revolution is rewiring the adolescent brain. It's very important for you as well as for your next generation because, as we all know, COVID, pandemic, lockdown, online education has created a situation in which people were glued to digital devices. And still we are unable to recover in toto from that phenomenon. So digital addiction or behavioral addiction as we call it, a situation where the only thing which gives you pleasure and enjoyment and fulfillment happens to be the digital device. So this has led to a scenario where 4 major problems have happened in the life of the youngsters. Number one, they have become disconnected from the society at large. I imagine that when I was of your age, the most important thing which used to give us happiness was connecting with friends. We could not imagine sitting inside a room and reading books or watching TV or anything like that. We needed human connect to survive. What about the present generation? What about you? Do you need human connect anymore to survive? Maybe a digital device within the comforts of your own room, you can survive for n number of hours. This has led to this social disconnection syndrome in which we have inability to understand the emotions of another person, empathize with him, and contribute positively to the society at large. That is the first problem. Second is, what is the average time in which you go to bed? An ugly question to ask. When India gained freedom way back in 1947, people used to go to sleep by 7:30, maximum 8, because there was no electricity and kerosene was costly. So no productive activity was possible after 8 p.m. One generation hence, 1980s, people used to go to bed by 9, 9:30, max 10. But I guess that, at least I'm a teacher who is teaching in medical college, my students tell me that the average age of sleep or average time of sleep is between 3 to 4 a.m. in the morning. Am I right? Unfortunately, classes begin at 8 a.m. itself. So they have to wake up at 7:30 and run to the college. So 3 to 4 hours of sleep. Sleep deprivation. This has led to 2 major issues. Number one, have you heard about Flynn effect, F-L-Y-N-N-E-F-F-E-C-T? Anyone? Please raise your hands. Okay, let me make that very simple. Am I more intelligent or are you more intelligent? Who is more intelligent? Evolution says that you are more intelligent than me. Human race is advancing with every generation, right? So Flynn effect is this phenomenon in which the IQ of every generation is at least 2 points higher than that of the previous generation. So you are more intelligent than me. But for the first time in the history of the world, 2022, a study done in 2022 after the COVID pandemic showed something called reverse Flynn effect. The IQ of the younger generation was 1.2 points less than that of the previous generation. What was the reason? Directly correlated to the gadget use. So sleep deprivation can translate into reduced intellectual capabilities and mental health problems. So that is the second issue. Third one, are you able to tolerate this lecture? If it was school students belonging to 7th standard, 8th standard, would they have been able to tolerate this? I'm sure not. Why? They are exposed to so much of visual media, which is very swift in speed, including online games, reels, shorts, etc. That anything which is less pacey than that is intolerable. So attention fragmentation, that is the third problem. And all these three adds to the fourth major problem, the most important problem affecting the youth. What is that? Dark web, exploring the potential to obtain various kinds of banned substances and getting addicted to that. So substance use disorders or addiction disorders. So these are the four major problems which the digital revolution has created in modern times. So with these few introductory words, I'm opening this session for your questions. Please feel free to raise your questions. We'll discuss. Yes, please. Thank you very much for volunteering. Can we have a mic? Please introduce yourself by your name also, so that if we meet in future, we can have a...
Good afternoon, sir. My name is Ashin Alex. I am come from Kottarakara. So you talked about sleep deprivation at first. So I am a person who actually suffers most. I suffer most with sleep deprivation. I constantly sleep at around 3 a.m. or 3:30 a.m. and it's before I go to sleep, I actually do a mental gymnastics to find out how many hours of sleep I can get. At what point do I have? So what can I do to improve this? So I would like to sleep at a normal hour, but every day it's like I sleep the next day. So what can I do to improve this?
Thank you very much for that wonderful question. It's useful to all of the people sitting here, I guess. Simple thing. First step to solve this problem is something called sleep hygiene exercises. Sleep hygiene exercises are a group of simple lifestyle modifications, 5 or 6 very simple things you can do. Only thing is that you should be motivated enough to do it. Number 1, go to sleep at a fixed time and wake up at a fixed time at least 6 days in a week. Maybe you want to play Free Fire today, so you will be sleeping at 4 a.m. Then a Netflix series has arrived, so you binge watch it till 3 a.m. And on the third day of no such responsibility, so you'll be sleeping at 10. You're confusing your brain. At least 6 days in a week, go to sleep at a fixed time, wake up at a fixed time. Maybe Saturday evening you can indulge a little late. Nothing is going to happen. Number 2, avoid tea, coffee and cola after 4 p.m. in the evening. Because all these contain caffeine, which stimulates your brain, makes you awake at night. So drinking tea and coffee after dinner is not a wise exercise. And those people who are above 40, a few of them are here, you need to get rid of tea and coffee in the afternoon itself, after 2 p.m. itself. Very difficult thing to do. Number 3, exercise with exposure to sunlight around 5 to 6 hours before your proposed sleep time. You plan to sleep by between 10 to 11, between 4 and 6 p.m., do physical exercise with exposure to sunlight for 1 hour. It can be vigorous physical exercise. Different types of physical exercises are there, though it does not pertain to the question per se, just a small piece of information. You can brisk walk, jog, sprint, play football, swim, or even cycle, which is the best form of exercise. Simple answer is any exercise in which your body weight is supported by your knee joint is the best exercise. Why? Because if you do an exercise in which your body weight is supported by the knee joint, more calcium will be deposited in your bones. And the amount of calcium in your bones is inversely proportional to the amount of calcium in your coronary arteries. What is coronary artery? The blood vessel supplying the heart. So if you walk, jog, sprint or play football, more calcium will be deposited in your bones. Your bones will be healthy and strong. You will not sustain a fracture due to trivial injuries, number one. Number two, this calcium will not go and get deposited in your coronary arteries. So your heart will also be healthy. So that is the importance of walking. Again, the next thing, take your dinner at least 2 hours before your proposed sleep time. Why? The present youngsters, their routine is such that they don't have breakfast. So acid surges in your stomach. You'll be having a sham lunch, maybe something. In the evening after 4 p.m., you'll have some major amount. And at midnight, you'll have your major meal for the day, which will be dinner. Then you drink 2 glasses of water or cola and immediately go to bed. What will happen? The acid which is surging in your stomach will mix with all these spicy food, get mixed with water, and it will lead to something called gastroesophageal reflux. At midnight, there will be some burning sensation or cough or breathlessness. You will wake up. So to avoid that, have your dinner 2 hours before your proposed sleep time. And most important and most difficult thing, avoid all visual media at least 1 hour before your proposed sleep time. If you plan to sleep at 11 p.m., by 10 p.m., switch off your mobile, iPad, tablet, laptop, desktop, and television. You can read your books. The best way to get sleep is whatever subjects interested you in college, within inverted commas, take those books. So any medical students here? Yeah, for medical students, you can read Park's textbook of social and preventive medicine to get good sleep. So depending upon your subject, you can select your book and try to read the hard copy of book. And some simple breathing exercises just before bedtime. That also helps. Simplest thing is 1:5 breathing, and sit straight in a chair with your head, your neck and spine in a straight line. Inhale deeply, taking 1 second time. Exhale very slowly, taking 5 seconds time. Repeat that for 20 times with your eyes closed. Then go to bed. Most often you'll sleep well. So this is sleep hygiene. Please practice that. And remember, if you exercise regularly in the evening, you're most likely to get a continuous sleep. Thank you very much. Let's go to the next question. Yes, please.
Good afternoon, doctor. I'm very happy you brought the concept of sleep deprivation into the limelight. So the question I have is, me myself, I try to sleep very early, as early as possible. The problem is that there are instances in which I would go for a long drive and I would be back by 1 or 2 a.m. in the morning. Is there any way to compensate the deprived sleep? I hear there is a concept which is sleep debt. Sleep debt, right? Is there any way we can recover that sleep debt? But at the same time, if I take an afternoon nap, if it's more than 1 hour, I get a sense of lightheadedness. Like, how do you treat that?
Thank you very much again for that wonderful question. Your voice is great. You have a very great future as a motivating speaker or anything related to training. I think you should try that. The throw of your voice is wonderful. Again, regarding this concept of sleep deprivation as a consequence of some work you're doing or some travel you're making, there is something called melatonin in your brain, which I'm sure most of you know. This melatonin is secreted by something called pineal gland in the brain. Melatonin production starts by around 8 p.m. after there is absolute darkness. Around 10 to 11, it peaks. And that peak level is sustained till 6 a.m. in the morning. Once sunlight arrives, melatonin drops, and around 7:30, it just vanishes. So if you sleep at the time in which melatonin production is at its peak, you're most likely to get a continuous, uninterrupted, and comfortable restorative sleep. That is what science says. But of course, if due to some reason you're in a shift work schedule or something, in such situations also, there are certain companies who do this kind of a harm to their employees. The schedule will be like 8 a.m. to 4 p.m. one day. Second day, it will be 4 p.m. till midnight. Third day, it will be midnight till 8 a.m. That is the worst you can do to your employee because you're confusing the brain if you frequently change. Maybe once in a week, if you are late for sleep, doesn't affect your brain. Maybe up to maximum 2 days in a week if it happens. It may not create a problem. But if it is happening more than twice in a week, your brain starts becoming confused. So that is number one. Number two, there are individual variations. Certain people sleep very late and wake up very late in the morning. So if you're getting refreshing sleep, what is the criteria for a refreshing sleep? You wake up in the morning feeling satisfied of the duration of sleep you have. You're able to process information immediately on waking up, and you are able to attend to anything which you are supposed to do continuously right from the morning. If that criteria is satisfied, you have got restorative sleep, it's fine. Regarding sleep debt, again, one position statement which was published recently by the American Heart Association says that the biggest cause of heart attack in youngsters, less than 40, is sleep deprivation. So 7 to 9 hours of restorative sleep is mandatory for the health of the heart. Because if you don't sleep for 7 hours, what happens is that a lot of toxic chemicals in your brain, like catecholamines, adrenaline, noradrenaline, etc. Then glucagon, which increases the level of glucose in the body. All these things increase. So your blood pressure goes up, your blood sugar goes up, the pumping of your heart becomes dangerously erratic, and you are very highly probable to develop a heart attack. So again, regarding the concept of sleep debt also, lot of conflicting evidence and conflicting research about that. But from what we have experienced in our part of the world, try to sleep for at least a minimum of 49 hours in a week. That is a minimum. So even if your sleep is disturbed for one day, if you can compensate it the very next day by sleeping a little more, that will be fine. Regarding the second part of your question, nap. Remember, daytime you can nap, but don't sleep. What is the difference between a sleep and a nap? Nap means it's a short rest you take, 30 to 60 minutes. It should not be more than 60 minutes. One sleep cycle happens to be around 45 minutes. That is the ideal time for a nap. It should not be more than that. Because if you sleep during the daytime, there is increased likelihood of excess absorption of carbohydrate and fat into your body. And this carbohydrate and fat get deposited in two parts of your body. Number one, liver, and number two, pancreas. So this fat deposit in the liver leads to MSAFLD, metabolic syndrome associated fatty liver disease. Very dangerous thing. And if it gets deposited in the pancreas, it can lead to diabetes. So don't sleep, just nap. Max 1 hour. That is maybe in the afternoon, not more than that. Thank you.
Good afternoon, sir. Thank you for the session. So I firstly want to apologize for keeping you lingering in this area of sleep and sleep deprivation when the topic is largely mental health. Now, my question is that, so see, I am a person who studies law and I'm in my 4th year. So like most of the people here, or I assume most of the people here, we pull a thing called all-nighters during examinations. All right, so what happens is that we stay up for more than 24 hours, close to maybe 32 or 36 hours for that matter, till whenever our exam is over. So sir, what are the methods? See, and this is not something I'm proud of. I would want to get rid of it. That is also something I want to mention. But what are the methods we can use to, sort of mitigate the risks that comes with it? And the easiest way, obviously, is to study earlier. But apart from that, how to mitigate this?
Thank you very much for that very relevant question again. Even I have done the same during my student days, and during our internship, we were supposed to take duties for 48 hours and 72 hours continuously. We used to say proudly that we are like that, but it took a toll on our health. So what we need to do here is, number one, there is a relationship between intelligence and sleep. Whatever you read and learn and master and study during the daytime, it gets organized in the brain at night during sleep. This process is called consolidation of memory. And for consolidation of memory to happen effectively, you need 7 hours of continuous sleep. So what happens often is that on the day prior to the exam, you don't sleep at all. I'm sure that the entire thing which you have learned will not be recollected on the day of the exam. Reason is it has not been effectively consolidated. So even on the day prior to the exam, sleeping for at least 6 hours, because 6 hours is the minimum time which is necessary for this consolidation of memory to happen effectively. So that is the best way. So regarding the other thing, studying early is not feasible, I accept. What you can do is, you can do something called smart work instead of hard work. So the law has changed. So many new sections and confusing things, and the language of law itself is so confusing, that it becomes very difficult. I have to read certain sections of the law, Mental Health Care Act and some other acts also, and I have to teach my students that also. It becomes very confusing even for us, so I can understand what you are going through. But of course, it is the best profession in the world. That is what I personally feel, because if you see the people who have ruled different countries in the world, we can't see any doctor there, but hundreds of lawyers have controlled the destiny of the world. So it's a wonderful profession. What you can do is, maybe you can resort to certain easy study techniques like mind mapping or spider notes or things like that. It can be very effectively done with law. And the advantage is, if you create these mind maps and such notes, you can keep it in safe custody and revise on the previous day of the exam just by going through that. So you'll be able to revise the entire syllabus. We have kept everything in the form of a mind map. That will reduce your strain on the brain. And again, in future also, whatever you study right now is not going to end with your final year LLB exam for sure. You'll have to refer it multiple times in future as part of your profession. Again, whatever you have kept in that way, it will be absolutely beneficial to you in future also. So I would recommend that you should sleep for at least 6 hours on the day prior to the exam also. Then only whatever you read will be effectively consolidated. Thank you.
Any more questions? Maybe not sleep related. Nobody?
Hi, sir. So I have primarily 2 questions. So, as a student of counseling and a practicing counselor too, my question is on the suicidality or the suicidal ideation as such. So 2 questions. One question is that when a teenager, per se, thinks about that, I have to quit. At that point of time, why do you think that those people are not thinking about that I have a peer system, or that thought is not clicking? So why do you think that is happening? And second question is that in our friendships also, that we see that there is lack of intimacy in the sense that when we share of our problems, they are not really coming up to it, or just staying on the peripheral level and then going ahead with it. So why do you think that people are not getting these bonds? And in fact, I think that is also one of the issue, because the cases that I get as a counselor too is because they are not really getting someone to talk to or someone to listen to. So why do you think that is happening? So 2 questions.
Thank you very much. Suicide is a major issue because 10,972 suicides in a single calendar year in Kerala. 15 times those much suicide attempts, 1.5 lakh plus people have attempted suicide. And again, if you take the whole of India, 13,298 students have killed themselves in India in a single calendar year. And we proudly say that the student population is the biggest asset of India. They would have survived somewhere. So a 75-year-old man with cancer which have spread to different organs, with severe bodily pain, inability to have food and sleep at all, trying to take his life may be an understandable human experience to a certain extent. But 18-year-old, 19-year-old, 20-year-old people trying to take their life when they have issues which are largely resolvable, it's a major issue. Here, I like to introduce two terms to you. One is loneliness and second is aloneness. What is the difference between those two? Said that loneliness is aloneness misunderstood. Loneliness is a situation in which the society isolates you, ostracizes you, regards you as a person not worthy of being interacted with. That is one thing. And aloneness means you have a lot of people around you, willing to help you, but you don't see anyone among them. So this aloneness is a characteristic trait of the present day digital era. I'll just go to the topic which I started speaking about, friendships. 1938, Harvard University started a study called Harvard Study on Human Development. It's the largest and longest study on human development undertaken anywhere in the world. 88 years, 30,000 plus people have participated. So that study has pointed out 5 factors which influence lifespan of human beings. Proper diet, regular exercise, abstaining from alcohol, staying away from all kinds of tobacco products, all these enhance lifespan. But the biggest and most important factor which influences your lifespan is the number and quality of human relationships established, especially during your childhood and youth, till 25 years of age. How many friendships you develop and what is the strength of that relationship. That is the most important determining factor. Regarding the second question you have asked, human beings have got 3 phases. One is the social phase, which everyone knows. Second is a little bit more personal space, which people very close to you know. And what is the third phase? A phase which only you are aware of. You don't wish to reveal it to anyone else. 21st century is the century of personal liberty and freedom. People can think out of the box. Lot of issues, including sexual orientation, gender-related issues. So many such issues are there, which are openly discussed, deliberated, and normalized. So still, there are social taboos associated with quite a lot of such issues. So if I open up about such an issue, will the person sitting next to me be able to understand, listen, and accept me as I am? It's a big question. So that is the question which we need to answer. So whenever a person is having self-harm thoughts, I guess that today morning another session discussed about non-suicidal self-harm, right? So that is another kind of self-harm in which you don't want to kill yourself, but you inflict certain pain on your body using some compass or divider or blade, and when some blood is released, you feel relieved. It's part of something called emotionally unstable personalities. So what we can do is, there is something called mental health first aid. I would like to introduce this concept to all of you. All of you should be aware of what is mental health first aid. So you have heard about first aid when a person is bitten by a snake or struck by a lightning or has potentially drowned. But we have never been taught about this mental health first aid. When we see a person in our knowledge having a psychological problem, whose behavior seems unlike his usual self, we should do this mental health first aid. 5 very simple steps. As a counselor, you'll be well aware, but I'm talking to the other people in the crowd. Number 1 is approach the person. Proactively approach that person and inquire with him regarding what is troubling him. Because you don't expect that person to open up with you. What is toxic masculinity? What is toxic masculinity? Is the suicide rate more in males or females? Completed suicide is more in males because society has decided there are certain aspects and attributes of a male. A male should be sigma. He should be competent all by oneself, should not ask for help, should not cry, should not complain of pain, should not take treatment for trivial things like fever and respiratory infection, and should never take treatment for mental health problems. That is toxic masculinity. See a lot of news in newspapers about how a 16-year-old boy has slipped and fell from the top of 10th floor of his apartment. How an 18-year-old boy has met with a bike accident. How a 19-year-old college student has drowned at Kovalam. Many of these accidents, believe me, they are suicides conveniently masqueraded as accidents. Why? Because this philosophy of toxic masculinity sticks to you even at your last breath. And it's an arrangement of convenience for the parents also. Because if you have lost your son due to an accident, the entire sympathy of the society will be with you. But if your son has died out of suicide, valarthu dosham, isn't it? So that is another major problem. So don't expect an adolescent to come and open up to you, especially an adolescent male, or even a female who is suffering from the disease of toxic masculinity. Toxic masculinity is unfortunately not restricted to males. Even females go through that. So proactively go and inquire with them regarding what is troubling them. Number 2, be a patient listener. Be an empathic listener. Listen without interruption, intrusion, mocking, trivializing, scolding. Just give an patient hearing. Because maybe for the first time, somebody is willing to listen to that person non-judgmentally, without scolding him, without criticizing him. Third step is give information and reassurance. Maybe he is disturbed because of a false notion. Correct that. Give the correct scientific explanation. Maybe he's going through a major problem which we cannot solve. Maybe his father is going through stage 4 carcinoma with metastasis. He is in his deathbed. We can't say that it doesn't matter. It matters the entire world to him. But in such a situation, we can offer reassurance. We can tell him that within my limitations as a human being, I will be there for you in the best possible way I can. That is realistic reassurance. So if you give these 3 things itself, 50% of the people may be fine. Still, if the problems remain, we go to step number 4, that is encourage professional help. Refer the person to a professional. If it is very intense suicidal ideas, if there are psychotic symptoms like delusions or hallucinations, the person is actively trying to kill his life, he needs a medical attention. Maybe he has to be referred to a psychiatrist. If it is not so intense, if he is willing to communicate and talk and listen, if you feel that he has insight about his problems and is capable of communicating, a clinical psychologist may suffice. And 5th one, the most important point, encourage social support. If a person is stressed, is actively suicidal, it is the responsibility of his relatives, his parents, his siblings, his peers, his neighbors, and the entire society to ensure that he doesn't feel isolated. We should be along with him and should not allow him to be alone till he tides over that suicidal ideation. So if we do at least these things, we may be able to sort it out to a certain extent. Thank you. Yes.
Hi, sir. Sorry for taking your time again. So, I hope to be a teacher in the future. So, we have a generation that thinks this whole mental health or mental illness is not takes it very silly. They don't consider it something serious. So, and these people have children. So, if the children is facing such anxiety issues or such depressive issues, how can we convince these parents or teach this or tell these parents that what their children is experiencing is real, it's actually affecting their life, and normal methods won't actually work on them, they need proper help. How can we talk to the parents about this?
Really difficult scenario, because as a teacher I am facing the same issue with regards to parents of my children, because I feel the youngsters are more cognizant and aware of mental health issues. And what parents say is that they are blowing things out of proportion. They are misusing the words like trauma and depression and trying to get sympathy and escape from responsibilities. That's the thought process of the parents. There is one phenomena which is never ever going to change, and that phenomena is called juvenoia. What is juvenoia? Juvenoia, juvenile plus paranoia. Every generation feels that the next generation is immoral and is going to ruin the world. We have heard that from our parents. Now we are telling the same to the next generation. And probably you will tell the same to your children also. Because that is, again, just like Flynn effect, a phenomenon which is unchanging. Here again, what happens is that parents compare their adolescence to the adolescence of their kids. But there is fundamental difference between the adolescence of the parents and the adolescence of the kids of the present generation. Maybe during our adolescence, this human support system was very easily available because there were no other options. We never had any digital device. We could not sit in a hostel room or home and enjoy. Maybe some intellectuals were into reading stuff could do that, but 99% of us did not belong to that category. So we were connected. We were connected. And so whenever we had a problem, we used to get help, even unsolicited help from our friends. And that support system helped us very much. But the younger generation, especially students of the present era, we should understand that they are fundamentally suffering from the social disconnection. And they have got issues which are still considered taboo by the parents' generation, but they want to open up about it. They consider those issues as real. So we can teach the parents two things. Number one is to spend quality time with the children at least 1 hour every day, irrespective of the age of the child. It should start from 3 years because that is the age in which children develop visual memory. And it should continue till the end of your life. It should continue because what happens is that once the children get into 8th standard, parents start distancing themselves because of two reasons. Number one, they are not aware of how to handle this tall person, Should we handle him as an adult or a child? And number two is that children demand all sorts of things, Apple 17 Pro and all sorts of things. And if you shout at them and create a distance, parents can happily escape from such kind of demands. But the reason why I'm telling this is that an adolescent, 13, 14, 15 years of age, is actually a child who wishes to be loved and be taken care of. AI വന്നാലും മറ്റെന്ത് യന്ത്രം വന്നാലും നമുക്കതിനെ മറികടക്കാൻ ഒറ്റ മാർഗ്ഗമേ ഉള്ളൂ. അതെന്താ? This affection, love and care which we can give to another human being, that cannot be replaced by any technology. That is the only thing which is going to help us survive any technological overpowering. So we need to tell the parents that they should listen to their kid for 1 hour every day. Just listen to their kid. Don't advise, don't preach, don't mock, just listen. That is number one. Number two, we need to teach them about warning signs of dangerous mental health problems. I'll tell 5 or 6 very simple things. Number one, the person is getting locked in his room for a prolonged period of time and his physical health is deteriorating. His eyes are bloodshot. He is losing weight significantly. He's not sleeping, he's not eating food. Warning sign number one. Probably he's into drug use or he has got into major behavioral addiction related to gadget use. Number two, he's not opening up about his friends to the parents. And a new group of friends have surfaced who are age inappropriate friends. And they are not revealing the whereabouts of these friends. They go with friends and don't wish to talk about friends. It's a potential possibility that they are under unhealthy influences. Number two. Number three, any suicidal behavior should be taken seriously. Any attempt to injure oneself should be taken seriously. Korekkunna patti kadikilla ennu parayum, but is not true with regards to suicide. Any warning sign should be taken seriously. Any sleep deprivation should be taken seriously. Any fears and suspicions which look irrational should be taken seriously. Like the child is telling that, I don't want to take bath because somebody has planted a camera in my washroom. You may have this tendency to laugh it off, but it could be a delusion. You should take it seriously. And if the child is doing some repeated things over and over again, which is taking a lot of his time, including taking more time for bath, repeatedly washing or repeatedly checking, it could be the sign of an obsessive compulsive disorder. And the last point is any sudden drop in academic performance. A student who is well performing, suddenly there is a drastic drop in academic performance, it requires serious help. In all these situations, talk to the child first. Give him an non-judgmental hearing. If you find that these kind of things surface out of it, definitely give him a professional help. That is what we need to teach. Thank you.
Good afternoon, dear sir. First of all, thankful for your presence in this session. So, sir, as you have mentioned in the introductory part regarding the attention fragmentation. So, being a teacher, I can understand that the present scenario, the students have very reduced attention span. So, is this attention span directly related to the sleep or the overusage of gadgets? Or is there any other factor responsible for the reduced attention span? And how can we improve the attention span of the students?
Again, an extremely relevant question. I'm extremely happy that I came today here to get these wonderful questions. Attention is directly related to something called dopamine in your prefrontal cortex. Prefrontal cortex is a part of the brain just beneath your forehead. So just like we keep a gate in front of our homes, the dopamine in the prefrontal cortex help us to selectively perceive what we need to focus and edit out all the other things. So if I say that you have 10 units of dopamine in your brain, you will be able to focus on this boring lecture after forgetting about all your personal problems. Certain people will have just 5 units of dopamine in the brain. And that will lead to a stage in which your gate of the brain is collapsed. All the sounds in the neighborhood will be perceived with equal intensity. You will get distracted. And there are 3 reasons for that fundamentally. Number 1 is definitely gadget addiction, especially getting addicted to videos and visuals which move at very swift speed. Example, cartoons, online games, and the habit of watching any other visual media in 1.5 or 2 speed, even if you want to watch a YouTube video, there is a pace in which your generation does so. Repeatedly doing that, your brain will be accustomed to that pace, and anything which doesn't follow that pace becomes intolerable. That is point number 1. Number 2 is sleep deprivation. If you don't sleep for 7 hours, the metabolic waste which are generated in the brain cells, they are excreted at night during sleep. And for that also we need 7 hours of sleep. If you don't sleep so much, the metabolic wastes are still deposited in the brain cells. You'll be feeling lethargic and inattentive during the daytime. Third is lack of exercise. Because if you don't physically exert yourself, you have 4 major deficiencies. Anyone who is exercising for 1 hour with exposure to sunlight will have increased dopamine in the brain, improving your attention. They will have increased endorphins in the brain, making you more happy. They will have increased level of blood flow to the brain, making you more energetic. Most importantly, if you expose yourself to sunlight, vitamin D will be high. And vitamin D is vital in your information processing. So these 3 things, if they are rightly done, you will be finally able to focus. And I can tell you a simple exercise also, which will help yourself and maybe the next generation to improve your attention span. This is simple exercise is called mindful breathing. I think we can do a small demonstration for 1 minute. You can sit straight in your chair with your head, your neck and spine in a straight line. You can keep your chest on your left palm over your chest and right palm over your stomach and close your eyes. Just focus on your normal breathing. Just focus on the flow of air through your nostrils. The air is flowing through the nose, coming down through the throat, filling the lungs in the chest. Follow the air as it comes up from the chest, out through the throat and out through the nose. Just focus on the cool sensation of air in your nostrils. When you're sitting like this, your mind may get distracted to other thoughts. Every time your mind is getting distracted, immediately bring your attention back to breathing. Every time your mind is wandering away, immediately bring your attention back to breathing. And continue to focus on your breathing alone. Okay, you can open your eyes for want of time. Please practice this exercise for 15 minutes in a day. 15 minutes at a fixed time of the day. Best time is morning. If you don't have time in the morning, at least in the evening. If you do this regularly for 15 minutes every day for 3 months, I can assure you that you will be able to focus and read whatever you want to do even while sitting in a cinema theater. So that is one simple technique to improve your attention span. I think the time allotted to me is over. Yes. So I have been asked to stop. Thank you very much for your very patient listening.